Do you have a bunion and want to avoid surgery? Do you have a special event and want to keep wearing the shoes you love and keep active? Make sure you watch this video. I'm going to take you through a case study of a patient who was getting ready for her wedding and was worried that her sore bunion would stop her wearing the shoes she loved on her big day. So my name is Daniel Fitzpatrick from Sydney Foot Solutions. I see stacks and stacks of bunions. In fact, we have over 100 bunions a week come through our clinics, and we have been experts in treating bunions for well over 20 years. And the great thing is that in most cases, unless the bunion is very severe, we can usually avoid the need for surgical intervention. Make sure you watch this video. I'm going to give you some really helpful tips on how you can help with your bunion, how you can keep wearing a variety of footwear. You can even wear heels if you want. And I'll take you through some key points with that. Now, I want to share a story about a patient who's just finished up treatment with us. She's due to get married in the next couple of months. She came to see us. She was having quite a lot of pain through her big toe. She was concerned that the pain in her big toe would stop her wearing heels or nice shoes on her wedding day. And so the great thing about what we do is that we're not reliant on orthotics. You don't have to consider surgical intervention, and you can keep wearing the shoes you love, because what we do is we can physically change the alignment of your foot and also improve the alignment of your bunion without being reliant on an external device like orthotics and things like that. And the great thing is that, yes, I'm not saying heels are good for you, but the idea is that we can work with you so you can do that. We can strengthen the relevant areas so your foot becomes robust, so you can keep wearing the shoes that you love indefinitely. And that's a really important aspect to what we do. So if you're wondering how we did that, so I'll take you through this particular instance with this patient, is that she came in for an assessment. We basically assessed what her individual needs were, double-checked everything, and then we decided to go off for a weight-bearing x-ray. Now, the reason we love a weight-bearing x-ray in this particular instance is that it allows us to double-check exactly what's going on in there. It allows us to diagnose where the underlying cause is coming from and the level of misalignment that's causing the problem. And then we can come up with a plan to go through and correct it. Not only can we improve the alignment, we can also improve the function, improve pain levels, and avoid the need for surgical intervention. And also, you don't have to wear orthotics to do it. So the way it works is it's just a gentle hands-on technique, and we're working with your connective tissues. I love the stuff that keeps your bones together. Connective tissues are quite adaptable. You can do a lot more with them than what people think. If you're trying to figure out where I'm coming from, connective tissues are made up of collagen, and collagen you can often get to adopt a new position. In fact, they do it with people's skin all the time. So we're all aware of that. Now, in terms of what we did with this particular young lady who is due to get married, is that it was a hands-on technique, and then we combined that with exercise therapy, and we also used laser to reduce the pain and inflammatory response. And it worked. Thankfully, it worked out really well. We just finished up her treatment process with us. She reported that she had had significant improvement in discomfort, in fact, pain-free. She was wearing a variety of footwear to work. She was wearing heels, all sorts of things. Definitely no pain when she was wearing her wedding shoes, particularly when she tried them on and wearing them around the house. And she's all set to go for her big day. We try and fashion our treatments so it suits the needs of the patient. And one of her big focuses was that she could wear a variety of footwear and she could avoid the need for bunion surgery. Being reliant on orthotics just wasn't an option in this particular instance. But what I do want to show you, I want to show you a really quick exercise that was super relevant to her. And it's probably super relevant to any female who wants to wear a variety of footwear, who has a bunion and a number of other foot issues. And what we do often find is that some of these muscles through here have a lovely holiday and they aren't doing what they're meant to be doing. So what we do find is it's really important you start to strengthen through the foot and ankle, and you start to address those underlying causes. This particular exercise was super relevant. So what you want to do for this is get yourself a towel and put it on a step, any household step. It doesn't have to be one of these IKEA steps that I've got. It can be any step around the house. And if you're wondering what you're doing is you're flexing your toe up on the step, and it's going to strengthen through these tissues here. The way that we do this is that we flex our toes just like this, and then we go down, 1, 2, 3, and then up, 1, 2, 3. So start with 2 feet, because it'll be a while to turn on those muscles, and then you can go to 1 foot, just like that. Okay. And what this is doing is it's strengthening through your ankle and your arch and really turning on all those tissues. I would do that 10 times, twice a day. Really great, particularly if you ever do want to wear a heel or anything like that, because it makes your foot more robust. It turns on your ankle muscles, turns on your arch muscles. Very relevant for this type of condition. And you might say, how is this relevant to the bunion? The reason it's relevant to the bunion, it turns on this group of muscles through here. and helps to straighten that big toe out. Just remember, we've got a 60% off initial bunion assessment where you can come in and get individual advice specific to your needs. Make sure you check out the link below, and we do stacks of bunions assessments. And in most cases, we can avoid the need for surgical intervention. I hope you liked this video. I hope it was helpful. Please, if you did the video, click on the like button. Feel free to subscribe to our channel. We try and put out lots of helpful videos on a weekly basis so that we can improve your overall health and also your foot health and avoid the need for surgical intervention and avoid the reliance on orthotics.